nonprofit.
Got it?
Cool. So, hello. Should we dive right in?
Absolutely.
Okay,
I'm delighted to be here with you.
It's awesome to meet you too. So, first of all, can you introduce yourself? Could you, just share a bit? Where were you born? Do you have siblings? Do you have pets?
So I am the director of the Centers for Disease Control and Prevention. I'm Rochelle Walensky. I was born in Massachusetts but raised in Washington, D.C., the D.C. area in Maryland. I have a husband who's a pediatric oncologist, and I have 3 sons. One of them, well, 2 of them have left for college, and they left us their goldfish. So we're feeding a lot of fish right now.
Fish, I like it. Okay, cool. So could you tell me a bit more about your job?
Wow. So the CDC has about 12,000 employees, and we work in all of public health throughout the country and really throughout the world. So in this moment, I think people know the CDC because we do a lot of guidelines and recommendations around vaccines for COVID and also for disease around COVID. But CDC's activities before everyone heard about it through COVID were really related to all infectious diseases and all of disease prevention.
So you collect data and you try to find the best way to prevent these diseases?
That's exactly right. So for COVID specifically, we look at every morning. I look at the data around the country based on cases and hospitalizations. A lot of the work is either in basic science labs, or diagnostic tests for how we might diagnose a disease. What if there's an outbreak related to lettuce, and a whole bunch of people who were eating that lettuce got sick? We would do the investigation to find the source.
Wow, cool. So like disease detectives.
That is exactly right. So disease detectives.
Yeah. The CDC recently recommended the Pfizer vaccine for children's ages 5 to 11. So what has the reaction of the public been?
Did you get your vaccine?
I did get my vaccine.
So general enthusiasm. There have been so many parents, so many kids who are breathing a sigh of relief now that they can protect their children because we want to make sure you guys are safe. And so really overwhelming interest, and some parents who want more information. And we want to make sure that parents are talking to their pediatricians to make sure that they get the information they need from somebody who they've trusted in your care.
So I was wondering, will we have to get a COVID shot every year like our flu shot? And as I mentioned, I'm a big wimp. I'm very scared of needles. So if so, can the flu and COVID vaccines please be combined into one shot?
That was a request?
That was a request, personally.
The first thing I should mention is you can get your COVID shot and your flu shot at the same time. So if you didn't get both of them already, one visit to your pediatrician or the pharmacist and you can get them both at the same time.
This next question is from a fellow TFK kid reporter. Her name's Lauren, and she asked, what impact might vaccinations have in schools, and when might we see this impact?
And maybe the question is also around masks, because I get that question a lot. First, let me say, I know you all want your masks off, and I want your masks off. And I know that's really important to you, and it is important to me. Really important to me also is that 99% of our schools are open right now. And I bet you're happy to be back in school, if I had to bet. And so my job is to make sure that you can stay back in school. The more children that we have vaccinated, the less disease that's going to be out there. And the less disease that's out there, that allows us to start peeling back our masks.
Thank you so much for your time. It was awesome meeting you and talking to you.
Thank you, and thank you for your amazing work at TFK.